We do listen to everything that you guys say. We read your evaluations, we do read your journal entries, and what we found was that there are a number of themes that that some of you had questions on. And if the question was posed, usually it's more than one person who had the question. So we decided to do something new this year, which we're calling a Scholar Spotlight. So this would be a chance for some of your colleagues to be able to answer some questions that you guys had. Tonight we'll be highlighting Karen Mendez. She is a second-year medical student at New York Medical College. And she'll be talking a little bit about IRB, what's the purpose of it, and what you can do with your project if, for whatever reason, you don't have IRB. And if you don't have IRB and weren't planning on it, some reasons why you may want to consider getting IRB approval. Karen, are you ready?
I am. Can you hear me?
Yes.
Okay, good. Just share my desktop.
And also just a bit of housekeeping. So everyone is muted right now except for Karen and I. Once she's done presenting, if you guys want to put a question in the Q&A section, then I'll be able to unmute you, and then you'll be able to ask your question out loud.
Okay.
Okay.
So I'm going to get started. As Jeanette mentioned, my name is Karen. I'm a second-year medical student at New York Medical College. And today I'm going to be discussing how we as medical students and student researchers can move forward despite delays in IRB approval. So first, I'm going to start talking about the purpose of institutional review boards for IRB. And as we all know, that the purpose of IRB is to ensure that appropriate steps are taken to protect the welfare of students, subjects, and research. And so it was long recognized that individual and community interests should be protected, but it wasn't until recently that measures were in place to ensure that there was national standards for the way research is conducted, and national standards to ensure that human subjects were protected. It wasn't until 1974 that the National Research Act was enacted by Congress, and it established guidelines for human subject research. And this stems from previous human rights violations, such as Nazi human experimentation and the Tuskegee syphilis study, which was conducted between 1932 and 1972 in rural Alabama on African-American men who had contracted syphilis, but they went untreated, even despite the researchers knowing that there was an effective cure within the study time frame. They withheld information and did not ensure that there was informed consent and that the patients were treated appropriately. And so following these human rights violations, it was acknowledged that measures had to be established. In 1978, the Belmont Report was issued, and it outlined 3 fundamental ethical principles for using any human subjects for research. The first one is respect for persons, and that's the concept of protecting patient autonomy, ensuring that human subjects are treated with courtesy and respect, and allowing for informed consent, and making sure that the human subjects know what is the purpose of research, and why they're volunteering for research, and what is going on. The second concept is beneficence, or to do good, which goes hand in hand with non-maleficence, which is to do no harm. And so basically, the researchers agree that the benefits should be maximized and the risks should be minimized for human subject research. Lastly, is the principle of justice, which encourages that benefits are fairly distributed among all of the participants of the research. And so this is a quote in a presidential apology following the syphilis study. This is a quote by Bill Clinton that I think captures the spirit of this whole process, ensuring that human subjects are protected. He said, it was a time when our nation failed to live up to its ideals, when our nation broke its trust with our people. That is the very foundation of our democracy. It's not only remembering that our shameful past that we can make amends and repair our nation, but it is in remembering that past that we can build a better present and a better future. And without remembering it, we cannot make amends and we cannot go forward. And so by establishing the institutional review board, we're making sure that we're building a better present and a better future for all participants in human research, of which we will all benefit from. And so today, as a student researcher, you have to ask yourself, when is an IRB approval indicated? And there's two questions that should follow. First of all, is this research, and am I using human subjects? So research is defined as a systematic investigation, including research development, testing, and evaluation, designed to develop or contribute to generalizable knowledge. And human subjects are any living individuals about whom an investigator conducting research obtains either data through intervention or interaction with the individual, or identifiable private information. And so depending on what type of research you're conducting, that will influence the approval timeline for your IRB, and it will also influence where in the spectrum the research falls, the risk and the extent of IRB review. So things that are lower on the risk spectrum are observational research, in which the investigator passively observes the nature as nature takes its course. Experimental research is higher risk because the investigator is actively manipulating the groups that receive the agent under study. There's also cohort studies, in which the subjects are defined according to their exposures and followed over time. There's case control studies, in which subjects are categorized as cases and matched with controls, and their unique exposure histories are compared. And then the last two on the list are more population-based. Cross-sectional is a type of study that examines the relationship between exposure and disease prevalence in a defined population at a single point in time. And an ecological study examines the relationship between exposure and disease at population level, rather than on an individual patient basis. So next, I'm going to talk about my own study. I called my study, the point of my study was to assess measures of pediatric growth in a low-income patient population outside of New York City. It was located in New Rochelle, New York. And basically, in my proposal, I sought to do a retrospective chart review with the understanding that this fell low on the risk spectrum, and also on the review continuum, I was likely to be approved more quickly because of the short time frame, and because I sought to use patient data that was part of the standard physical exam. And so my intent was to remove all identifiers, and like I said, I would be using patient data, but it was part of a standard physical exam, so I wasn't going to be conducting like an experimental study. It was more observational. And so I chose the site, Sound Shore Medical Center in New Rochelle. I selected the site because it was an affiliate with my institution, New York Medical College, and I was going there for my clinical skill development. My preceptor is a pediatrician at that site, and so I had an existing relationship with her, and she became my community site mentor. So a little bit about the importance of infrastructure. I was there starting in fall of 2013, And around November of 2013, South Shore Medical Center filed for bankruptcy. Soon after, it was taken over by Montefiore Health System. And this is a quote by the CEO that I thought was pretty telling. He said, "As is true with many community hospitals serving a working class constituency, the medical centers have been beset by the financial pressures caused by cuts in Medicare and Medicaid funding, declining indigent school payments, and changing demographics." So luckily, the hospital didn't close. It was taken over by a new health system, and so there wasn't a break in patient care. But still, the community and the patient population served by this hospital has been affected. And you know, I've been following the transition in the hospital, and I found out that last month it was designated as an area trauma center by New York State, and it was in fact the only area trauma center in southern Westchester or in that area. And so, you know, there are unique struggles of a community hospital. A community hospital is defined as an independent hospital that's not affiliated with an academic center. We have an affiliation, like I said, we had an affiliation, but it wasn't our hospital. It was still an independent hospital that we had a partnership with. And so it still functions as an independent hospital without, you know, the support that is in place when a hospital is part of a larger health system. I think that study design is important when seeking IRB approval and when conducting a study. And I thought that I had created a good study design, and I thought that I would be granted IRB approval quickly, because at the time when I decided to do the study, the IRB, I was assured that students were going there and students were getting the clinical experience and students had conducted research, and so it shouldn't be a problem. But I realized that I was still obligated to meet the deliverables within the time frame, and so I had to change what I set out to do to make sure that I still learned something from the experience and I was still able to meet the deliverables required by the National Medical Fellowship. So before I talk about what I ended up doing, I just want to talk about the implications of hospital closure, which in this case luckily did not happen, but also the implications of the transformation in the hospital ownership and administration and the trauma center closure. So obviously this had an effect on my project. A new institution came in. Montefiore is affiliated with another medical school in the area, is affiliated with Albert Einstein, and so we didn't have the relationship that I used to have with South Shore. And because of the changes, the institutional review board was run by Montefiore. And so at the time there was a lapse where the institutional review board was not meeting, which is totally understandable. I mean, they had a lot of more pressing problems, but this had an impact on my project where I was not able to obtain patient data. This obviously had a huge impact on the community, and low-income patients are particularly affected by such changes because this might be their primary avenue to seek health care, whereas a more affluent patient might use this as a safety net hospital because they have the resources to travel to their preferred site or to an alternate site. And so with hospital closure or with these changes, there's a potential for increase in healthcare disparities and morbidity and mortality, which as a diverse medical scholar, I'm very interested in. And as somebody who has a background in public health, that's a huge concern. And there's also obviously implications for neighboring hospitals who didn't expect to get increased patient load and who do not necessarily have an increased budget to support the increased flow of patients. And so as a result of all this, I basically decided to conduct a literature search to learn more about my topic of interest. I discovered what data existed on the measures of pediatric growth and how these measures were established. Through my medical school coursework, I was able to learn about the values that I was going to be analyzing, like blood indicators, collect blood indicators that are taken as part of the complete blood count. So I was able to see what data existed, but also I was able to learn about things that I didn't expect to learn about, such as, I learned firsthand the issues related to providing healthcare to underserved populations, and I learned firsthand about the influence of the economic climate on hospital budgets, and also I was able to learn about how different health systems and how academic centers help to support community hospitals or hospitals in general. So my recommendation to you, if you have an IRB delay, would be to be flexible, to expect the unexpected, and to realize that you have to keep moving forward. It might just be in an alternate path that you weren't planning. So basically, I would recommend that you find alternatives, and this might be an opportunity for you to become more informed about the topic of interest, or to become more informed about something that you didn't expect to be informed about. I would suggest that you prepare materials as if you were to be granted IRB approval. If there isn't a lapse in the IRB meeting or a change in like the institutional review board, it takes time to get approval regardless. And so I would submit a request with the awareness that that this is a process that takes time. I also, the reason that you want to conduct IRB is obviously to protect the human subject, but also as a student, I think it's a good skill to have, and it's something that you can put on your resume to say that you've gone through IRB approval, you know how to submit, you know what it takes to conduct research. Not only were you analyzing the data or writing out the reports, you also know what it takes to start the data, or to start the data collection and to start the project. And so, that is also a good skill for you to have and be able to market yourself with. Future directions. What I asked myself when I was creating my proposal for this year's project, I took the time to get to know the partner agency. I asked myself whether the partner agency had the infrastructure to support my community-based project, whether their IRB met regularly, whether they had a history of working with students, and if these students were able to conduct research in the past. So the hospital where I am now has a medical residency program, and the residents there are encouraged to conduct research. So they have the infrastructure in place to support students that want to conduct research, and like I said, they have an IRB that meets regularly. This time around, rather than analyzing data, I wanted to have more of a action-oriented project to make sure that the community would benefit from the study that I was conducting. And so questions that I think are important to ask is, what are the objectives of your study and what are the implications of your project? Will the community be able to benefit immediately? Will they be able to put the information to use? And yeah, what will happen long term with your project? So, the point that I want to emphasize is that I was still able to learn a lot. I was still able to deliver a report on my project, and it was a great learning experience regardless. You just have to find alternate ways to keep moving forward. So thank you so much for your time. Please let me know if you have any questions. And here's my contact information. Feel free to contact me and ask me any questions. There's my phone number and my email.
Thank you, Karen.
Thank you.
If anyone has any questions, you guys are currently all muted. If you could just write something in the Q&A section of the screen, and then I can unmute you for you to be able to ask your question. Okay. Well, if we don't have any questions, I want to say thank you, Karen, again for presenting about IRB and about your experience last year. I know we had a difficult time, and it was a bit frustrating, but I'm glad you're able to overcome it. And for everyone else, I will be contacting you shortly. We'll have our official orientation to learn more about what's ahead for the program this year. Thank you all for joining.
Thank you.